In this video, we're going to discuss bed baths. Um, Usually, when it comes to a lot of these tasks, we show you them one by one, but in reality, a lot of nurses do many of the things in one thing in one fell swoop, so that we can be a little bit more efficient. For example, we wouldn't just do a bed bath and then next do a skin assessment. We would do the skin assessment and a bed bath together. And so there might be pieces that we show you separately just because we want you to focus on each skill. But in reality, we just try to do what's more convenient, really, and easier for the patient and for us. Peri-care is another one that can be added into this. You could also see how you could try to do, if the patient was going to use a bedpan, then afterwards you'd be able to do skin assessment and bathing and then vital signs and everything all together at once to just try to, um, so that we're not bothering the patient every 15 minutes to try to do something because we have a lot of other things that we needed to do too. So in this video, they're doing the bed bath, and what I want you to note is that we're trying to keep the patient's privacy, covering him as much as possible. We don't want to, the reason that we're going to bathe him in sections is for the privacy, but also to, it's so we can maintain his body temperature. The other thing that I want you to note here, and this is just an example of the demo that we're going to watch, but nurses are not maids and servants to be at the service just because of the patient. Usually, when we do full baths like this, we do them because the patient is impaired in some way and is not able to. Uh, in nursing, we are always looking to try to foster the person's, you know, independence and freedom to do these skills for themselves. Um, to do these to when they cannot do something, it's called a deficit, and we need to fill these deficits, but we're always trying to get them to go back to whatever normal is for that one person. So let me give you an example. So if this patient that we're about to watch, if he was totally intubated, we're in the ICU, he's sedated and intubated, not conscious at all. Obviously, this is something that we're going to assume that we're going to do a complete bed bath on him. In the same way, using the same modesty, I know he's sedated, but he still needs his privacy, and we can't just expose him just because. So we're going to follow the same technique, and obviously because he's intubated and sedated, he cannot bathe himself, he cannot bathe his feet. What if it's another person, say somebody like me, and I came in for knee surgery, and I'm there overnight? Well, I'm not going to expect you to bathe every inch of my body, bathe my peri area, my back, and my ears because there's nothing wrong with I can do that. So for some reason, sometimes patients think that they're in a hotel and it's the spa service, and that's couldn't be further from the truth. So we also need to make note of that because that is a nursing skill altogether, is that we're again trying to foster the independence of the patient and get them back to their regular daily living as possible. I know for most patients, I think would appreciate being able to bathe themselves in private and in the comfort and privacy of their own room. I would rather do that than have somebody bathe me, but you do get those patients that expect everything to be done for them, and that's and I want you to try to think about that's the reason why we do this. Let's watch this video together.
Mr. Wilson, do you wear contact lenses?
No, I don't.
Okay.
Then begin the bath by immersing the washcloth in the basin. Wring it out thoroughly. Fold the washcloth to form a mitt and wash the patient's eyes with plain, warm water, bathing the eye from the inner to the outer canthus and using a new section of the cloth for each eye. Soak any eyelid crusts for 2 to 3 minutes, if necessary, before you try to remove them. Be sure to dry gently and thoroughly around the eyes. Next, ask the patient if he'd like you to use soap on his face.
Would you like soap to be used on your face, sir?
No.
Okay.
Then wash, rinse, and dry the patient's forehead, cheeks, nose, neck, and ears. Ask a male patient if he'd like to be shaved.
Would you like me to shave you today, sir?
No, I'm fine.
Okay. I'm going to start with your arm then.
Now remove the bath blanket from the patient's arm that is closer to you. Place the bath towel lengthwise beneath the arm. Bathe the arm with water and minimal soap, using long, firm strokes. Move in a distal to proximal direction, that is from the fingers to the axilla. Then wash, rinse, and dry the entire arm. Wash the hands and nails.
I want to add in here that the reason that the rationale that we use that we always stroke towards the heart to improve circulation. So that's just a general idea when we do massages or we start bathing, we do upward strokes towards the heart.
If the hands and nails need to be soaked, fold a bath towel in half and lay it on the bedside next to the patient. Set the wash basin on the towel and immerse the patient's hand. Let them soak for 3 to 5 minutes and then clean beneath the nails. Move the basin out of the way and rinse and dry the hand well. With the patient's arm raised and gently supported over his head, thoroughly wash, rinse, and dry the axilla. If needed, apply deodorant to the underarm. Standing at the other side of the bed, lower the rail, place the towel beneath the patient's other arm, and follow the same steps to wash that arm, as well as the axilla, hand, and nails. Cover the patient's chest with a bath towel and fold the bath blanket down to the umbilicus. Then bathe the chest again using long, firm strokes.
Rinse it off.
Check the water temperature now and change it if necessary. Otherwise, continue by washing the abdomen. Drape 1 or 2 bath towels lengthwise over the patient's chest and abdomen, folding the bath blanket down to just above the pubic region. Keeping the abdomen covered as you work, wash and rinse the abdomen under the towel, paying close attention to the umbilicus and surrounding skin folds. Dry the area and help the patient put on a clean gown or pajama top. If you prefer to finish giving the bath before you help the patient dress, continue washing the lower extremities, covering the patient's chest and abdomen with the top of the bath blanket.
We're going to move to your leg.
Then expose one leg by folding the blanket toward the midline, while keeping the perineum covered. Arrange the towel lengthwise under the leg. Now wash the leg, using long, firm strokes from the ankle to the knee, and then from the knee to the thigh. As you work, assess for signs of redness, swelling, and pain. Thoroughly rinse and dry the leg. Next, wash the patient's foot, cleaning carefully between the toes. Clean and file the nails as needed, according to agency policy. Rinse and dry the toes and foot completely. Soaking the patient's feet in warm water for 10 minutes can help maintain cleanliness of the toenails and feet, but never soak the feet of a patient with diabetes or any other patient with impaired sensation. Apply a little moisturizing lotion to the feet. Remove the towel. Raise the side rail. Move to the other side of the bed. Lower the rail and follow the same steps to wash the other leg and foot.